Hi students, today we're going to basically run through how to put on a 4-lead ECG as part of our vital sign assessment. We'll be working with the Life Pack today and our lovely patient Mark. So any patient that's got any sort of specific, you think cardiac related, overdose, pretty much most patients you should try and access a 4-lead ECG just to get a basic outline of what's happening with their heart. Life Pack monitor, turn it on, you'll find the 4-lead separate to the 12-lead and a packet of sticky dots in the back. So all you do is I've already done it though, pull out your dots. They all come with a little click on to the monitor. You can always put your sticky dots on first onto the patient, but sometimes it can be a little bit painful. All right, so you've got 4 leads, and the best way you can try and remember an acronym, whether it's your salt, pepper, tomato sauce, wasabi, or anything that sticks in your head. Explain to the patient what you're going to do. Now with the 4-lead, you can either put them on the chest or on the limbs. We're going to put them on the limbs just today for the first time. You get a more accurate anatomical read on the limbs, but obviously in pre-hospital care, you've got so many obstacles to get around with having legs out, injuries, that most times it's not accessible. So generally we'll put them on the chest, just in a one there, one there, one there, and one there. But we'll do it on Mark's arms and legs today. So always make sure your equipment is untangled. I like to go in a nice order. So your salt, or you can read the back of the leads, but they get scratched off. You're working in dark conditions, undesirable visual circumstances. So you just peel the adhesive at the back, and we'll do wrists. So what you're trying to avoid is any sort of bony premise, so avoid the wrist bones, any sort of elbow joints. This can just affect the conductivity. Then we go black one, you could call it pepper, or your left arm, and just do the same. If the patient's really hairy, you can always just use a razor and give them a little haircut. Okay, now with the red one, it's going to be a bit awkward. You just expose the leg, and same thing, just anywhere bottom. And last one, your green one. There's the thing. Okay, so as simple as that. So you've got your standard 4-lead on. Okay, and we can just do print. And you're asking the patient to hold nice and still. Beautiful. And we now have Mark's standard 4-lead read, so which you'll then further look into at your workshop. Basically, I think Mark's going to live today. He's got nothing unusual going on. And if we did suspect something was abnormal with Mark's 4-lead, we would then advance on to doing a 12-lead ECG to get further angle diagnosis. Okay, how was that, Mark?
Fantastic.